I am reaching out to all those in the faith community and all of those who voted for change in November of 2008. I ask that you review this email in its entirety and watch the 4 videos that are attached. They are there to empower you with the knowledge of what our healthcare crisis means to an American family, what it has done to our human rights, and what it has done to our economy and to our government. To set the tone for our human rights movement to demand universal access to affordable quality health care, I chose a quote from one of the greatest human rights activists of our time, Dr. Martin Luther King. Over 40 years ago, Dr. King stated, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." Yet here we find ourselves 40 years later having this same conversation of having all of us powerless and hostage to a healthcare system that is designed to protect profits and not human life. Reverend William Barber, the president of the NAACP and pastor of Greenleaf Christian Church, said, "This noise of the healthcare reform debate is about race. It is about othering a president. This is what animates the every move of some of the poor and working people who get sucked in by the fear-mongering. Unless our movement begins pushing back and telling the truth, we are all vulnerable and we will all lose this fight." The Wilmington Interdenominational Minister Alliance, Pastor Robert Campbell of the New Beginning Christian Church said, "We have decided to join the healthcare debate to help speak out for those who have been most negatively impacted by the healthcare issues, but have the smallest voice." The statements that I will make and the conclusions that I will make in here do not represent Pastor Campbell or Pastor Barber. They represent my own life experience and my own opinions. But I am honored to have them and be aligned with them in this human rights movement. Our healthcare and human rights crisis has been the cause and effect is that laws have been written to protect profits over people, capitalism over democracy, creating a health insurance industry's power that they have used to administer their very discriminate death panel, denying and killing 45,000 Americans a year. The private insurance industry decides who is worthy to survive disease and disability based on the size of check that one can write. 62% of Americans' bankruptcies are caused by our healthcare crisis. Our reality is that disease and disability do not discriminate, but the private insurance industry does. Our common enemy to our health is disease and greed. The private insurance industry has one goal: to generate profits through high premiums and denying the care that human beings need to live. The insurance industry adds zero value to healthcare delivery, yet they control our entire healthcare system. We are all vulnerable to extreme medical and financial loss because we are all held powerless to this healthcare system that is designed to protect profits and not human life. The insurance industry is spending well over $1 million a day to sponsor false commercials designed to incite fear and hatred and anger among the American people, to influence our public servants, and to divide and conquer us as a people. We must maintain our unity and demand that every American have the right to protect their greatest asset, their health. The private insurance industry has made affordable, quality health care a privilege for the young, healthy, and wealthy. The faith community human rights movement gives us hope. The people's power is found in our unity and in our knowledge. As a people of faith, we envision a society where each person is afforded health, wholeness, and human dignity. The humanity's solution to our healthcare crisis is universal access to affordable, quality health care, and that's through the public option. We must demand that our legislators legally document to protect and value all human life, not profits. Our moral obligation to humanity and the question that we must ask all of our people and our public servants is, how do we measure human life? The U.S. Declaration of Independence states that all men are created equal, that they are endowed by their Creator with certain inalienable rights, that among these are life, liberty, and the pursuit of happiness. Within the Bible, it states how God and how we as Christians should value human life. In Matthew 25:36, then the king will say to those on his right, "Come, you who are blessed by my Father, take your inheritance, the kingdom prepared for you since the creation of the world. For I was hungry and you gave me something to eat. I was thirsty and you gave me something to drink. I was a stranger and you invited me in. I needed clothes and you clothed me. I was sick and you looked after me. I was in prison and you came to visit me." This is our moral test of our time. We must ask ourselves, how do we measure human life and the worthiness to be protected under the law? Do we measure human life by the size of the check that one can write, by the tax dollar contribution one can make, by the status of one's well-being, by one's social economic status or the job that they hold or the material items they possess, by the education level that one has, by the color of one's skin? I tell you, as a faith community, we are confident that we will stand united as a humanity and as an unyielding force to demand that legislatively it be documented that we, the people, value all human life. Why healthcare matters to all people is that we are all vulnerable and held hostage within a healthcare system, powered and controlled by the insurance industry with one goal: to protect profits, not human life. A human being's greatest asset is their health. I assure you that you can do everything right, but we are all just one illness and disability away from medical and financial ruin. All in the name of capitalism, the insurance industry have been empowered to legally own every American's health and wealth as their free market commodity. We are all vulnerable in this healthcare system controlled by the insurance industry. Healthcare is not about what you or your family have today or the state of your well-being today. It is about the probability of what you could be faced with tomorrow. I ask you to ask yourself, what if? What if I lost my job and my private insurance? Could I afford to protect my family medically and financially on the private sector? And I assure you, you could not. What if I or my child became sick? Would the insurance that I have today protect the well-being of my family medically and financially? And I assure you it would not. We the people will accept no more excuses. Healthcare policy will be written to protect human life over profits. As Reverend Barber so eloquently put it, we will not accept the excuse of insufficient funds or deficit concerns from any public servant. Where were the public servants' deficit concerns when we went into a war we should not have gone in? Where were the deficit concerns of our public servants when we bailed out Wall Street, the banks, the insurance industry, the car industry? These bailouts and these wars have cost the American people $6 trillion, and our healthcare system is killing 45,000 American lives a year because they do not have access to the healthcare they need to live. We will not stand for one American to die needlessly at the hands of the private insurance industry. We ask for an American solution, and that's that we have the public health insurance option, and that we demand that laws be written to protect people over profits. Make affordable, quality health care a right and a responsibility of every American through a strong federal public health insurance option now, not a trigger. An option that provides all Americans with a choice and equal consumer protection under the law. The American solution that gives us real choice and a guarantee of quality coverage that we can afford, that allows us to keep our current private insurance plan if we wish, to pick a new private insurance plan if we wish, or to join the new public health insurance option plan so that we are not at the mercy of the private insurance industry. No matter your choice, you will get a guarantee of standard comprehensive benefits that meets your needs as an American citizen. In addition, you will pay for insurance based on your family's income, not your well-being, not your age, and not your social economic status. This is not about taking anything from one human being. It is about an exercise of equality, people over profits, restoring our human rights, our healthcare system, and our economy. May God continue to be the beacon of our light, our hope, and our inspiration, to be the voice of our most vulnerable members of society, our sick, disabled, elderly, and poor. we ask that our public servants protect all of our lives.